On the occasion of the World Diabetes Day for 2024, we at Dr. Mohan's Diabetes Specialty Center have great pleasure in inaugurating two more facilities which will be of great benefit to the public. The first one is called as a healthy aging clinic. Now, why should a diabetes center develop a healthy aging clinic? The life expectancy in India is rapidly going up. At the time of independence, the life expectancy was only 35 years in India. Today, it is 70 years. It is expected that in the next few years, it will go up to 75 or even cross 80 years. Now, what happens is that as people get older, a number of physical ailments as well as health issues as well as mental problems can set in. The first thing that happens is that people become weaker, they lose their muscle strength, we call it as sarcopenia, and this can result in what we call as frailty. They become very frail, and this tends to make people fall. Now, if they fall, if an elderly person falls, it's not like a youngster falling. Not only they can have fractures, but also it can affect their brain, because sometimes you can have a subarachnoid hemorrhage in the brain or a bleed, or sometimes the shock itself can lead to a rapid decline in their cognition. Cognition and memory are anyway a part of the aging process, and they start slowly dwindling with age. But there is a normal decline in the memory and cognition, and in people with diabetes, it is accelerated. In fact, we say that diabetes adds 5 or 10 years to your life, depending on how long you have had diabetes. People don't realize that, and people are not aware what is a normal memory loss, a mild normal decrease in the cognition, and what is a pathological one which leads to dementia like Alzheimer's disease and so on. This is a subject which is not frequently discussed. People don't look for it. And in a diabetes clinic, it is very appropriate that we should do this. Number one, because diabetes accelerates that process of memory loss, leads to decreased cognition, cognitive function, increases the risk of dementia. It occurs at a younger age, 5 to 10 years earlier, it can occur. And there's the kind of accelerated aging which occurs in people with diabetes. And because of the uncontrolled diabetes, they also have neuropathy, which means they don't have a proper sensation in the feet, which can also make them fall. As we are seeing increasing numbers of people who are elderly and coming to us, we thought it's a right time to establish what is called as a healthy aging clinic. And in this healthy aging clinic, we will be evaluating you for your physical strength, your muscle strength, whether you have frailty or not, and also doing simple things to quickly check whether your cognitive function is okay, or whether you have a mild cognitive decline, or whether it is more advanced and you're already developing dementia. Today, we have various treatments also to slow down this process of the cognitive decline, and in early stages of dementia, it can help as well. We also know that the type of diabetes treatment that we do, the usually aggressive treatment that we do, has to be slowed down, and the treatment should be made less intensive if your cognitive function is not very good. We believe that this will be the first healthy aging clinic to be established in a diabetes center, and I invite all those who are visiting our center as well as others who would like to make use of these facilities to come to the Healthy Aging Clinic. To start with, we are starting this in Chennai in our Gopalapuram main center, and we'll have a team consisting of a diabetologist, a neurologist, a, a counselor who does counseling for patients, a psychiatrist, a physical medicine expert, a yoga expert, and many others who form this team, multidisciplinary team, to look after elderly patients. We are sure that by doing this, we can improve the quality of life of all the elderly people with diabetes. So please welcome to the Healthy Aging Clinic at Dr. Mohan's Diabetes Specialty Center at Gopalapuram in Chennai. The other project that we are launching for World Diabetes Day is called Dr. Mohan's on Wheels. Now, traditionally, the concept of diabetes care is that a patient comes to the center, has the history taken, the blood tests are done, and then we have to go through all the other investigations, and then they wait maybe for a few hours, and then the results come in, and then we write the prescription for the patient, and the patient goes. And every time the patient comes, they have to repeat this procedure. Now, there are many people who are elderly who are not able to come often to the clinic because their children are working, they don't have time, they are not confident to come by themselves. And there are others who are young who are going to work all the time and they don't have the time to come to the clinic. So, by this concept of Dr. Mohan's on Wheels, we are offering world class quality diabetes care at your doorstep. So, we come to you, you don't have to come to us, we come to you, we check the blood test for you, we do the other investigations for you. A doctor will also come home and see you, and you'll be able to be in touch with your consultant physician and diabetologist and get advice. We'll also be able to do other procedures, not just glucose testing, but a whole range of other testing, physiotherapy, and many other things. You might need a dressing for the foot ulcer, for example. You might need, for all the way, you don't have to come using a vehicle and so on, to just come and get your foot examined and the dressing done. So we'll be able to do that at your home, reducing the cost for you. So on this occasion of World Diabetes Day 2024, we would like to offer these two new services for all patients and for everyone with diabetes: the Healthy Aging Clinic as well as the Dr. Mohan's on Wheels. I'd like to take this opportunity to wish all of you a happy World Diabetes Day. It is my dream that through the improved treatments, through regular checkups, through your own participation by diet, exercise, taking the medicines, and coming regularly for checkup, we'll be able to prevent all the complications of diabetes, whether it's the eye, the kidney, heart, nerves, feet. All the complications can be prevented. And my ultimate dream is to have a diabetes complications free India and a diabetes complications free world. That is my dream, and that is my message of hope for you on World Diabetes Day. Thank you very much.